places where we can revisit some of our, assessment things. Here, looking and palpating. With my client here, I can already see and feel a little bit of a tendency towards a right rotation. And I can reinforce and clarify that based on the range of motion. So I'm going to kind of exaggerate where my hand placements would be. Like I've always shown it this way, right? But if you wanted to go a step further, like how much does it feel like I can turn the pelvis this way? Versus how much can I turn the pelvis this way? Go around to the other side and confirm that. Does one way feel like it's easier or harder to do? If I go this way versus this way. That's one, if anybody can see this, looking over at me. Look at Sarah here, real quick. Look how much. It's a lot freer that way than here. And it just feels harder to do.
Okay.
Now, I could go so far as I've identified that. One thing I could do in the session is just sneakily do this a lot. All right, this is the way it doesn't want to go. It doesn't want to go into left rotation. So I'll just keep on, come on, remember, you can do that. As I work my way around the table, maybe I just keep on sneakily encouraging that rotation, right? This just could be something I'm doing as I move around and do the massage. I just occasionally come back and I'm like, come on. Remember. And that in itself might actually be the trick. With a lot of people, you'd be really surprised if you just sprinkle in all these joint movement things, and if you identify through your assessment, on table, all of that, you identify the movements that are seemingly not correct, especially when they're hypomobile, right? So I'm picking the direction that feels harder to do, no hard end feel, no pain, and then encouraging that. It'd be not dissimilar to here at the knee. Like I'm getting a sense of, oh, look at that, that's a good one. See how that pelvis picks right up? That would tell me the hip flexors are tight. Because some hip flexors attach to the knee. So if I bend the knee enough, whoo, they're picking up. All right, rotation, rotation, too much that way. So I might encourage through the session more of this. She's pretty good both ways, but it's feeling a little bit more restricted. Yep. And the story is all making sense. Like we're just too much here. You look at me real quick. Sarah's like all too much this way. I need to try to help go this way. And just there. And even if I just aim my intention, solid energy prayer as I do the session. Manifest it. You would be amazed. Paying attention to that idea and just being that mindful intention and focus over time will guide you as you start learning more and more about how the body functions, right? But just identify, you're like, all right, more of that, and like little things. I can be here. I can be here. You know, there's all kinds of like ways we could just be thinking to encourage that. All right. Blah.